Hi, I'm Dr. Brenda Howard, and this is Module 2 in Applied Ethics in Healthcare. Why do we make the choices we make? So this week we're going to explore how we use those principles and theories and frameworks that we learned about last week to make ethical decisions. How do they guide us? We're also going to be looking at how might our culture be influencing us as we're making ethical choices. These cultural influences are not good or bad, but they might be different from those of the people that we serve. Cultural considerations have long been absent from ethical decision making, so it's time to start paying attention to those influences as we make ethical choices. We're still looking at that first course objective, as far as analyzing the fundamental theories, principles, and frameworks, but we're going to be looking at putting them a little bit more into practice, and we're going to start applying them to a case this week. So we hope to apply those ethical theories and principles to analyze an ethical problem, and we're going to reflect on our own process for making ethical decisions. Those are our objectives and our goals for this module. So let's take a look at these two issues of beneficence versus autonomy. We have an article this week by Cohen who explores these dual concepts and how they interplay in clinical settings. To summarize the meaning of each of these, beneficence means having sympathy for people, and autonomy means having respect for people. When is it okay to ignore one for the sake of the other? So let me give you a simple example. A person is on the elevator crying. When you get on the elevator, you don't know them and you don't know why they're crying. Should you respect their privacy and not make eye contact and just let them have their own space? Or should you ask them what's wrong, offer them a hug? What's the appropriate thing to do? How does the scenario change if you get on the elevator and it's a friend of yours who is crying? Then the choice might be beneficence over autonomy, where you do give them a hug, where you do ask them what's wrong, where you do find out more about the situation. So which principle takes precedence is very situational. So how are we going to decide what to do in each situation that we encounter? Also, these philosophical principles of deontology versus teleology or utilitarianism is important for us to think about. The article by Bloom that we look at this week makes the case that knowing when to make decisions based on the ultimate good or deontology versus what achieves the most desirable ends or teleology operates not at polar extremes from each other, but on a continuum of cobbled together philosophies, much like a Rube Goldberg machine is what the author says. And I'm going to share a video with you all of a Rube Goldberg machine if you don't know what one is, or if you just want to watch something for a little bit of fun and to get us thinking a little bit. Sturm is an article that focuses on clinical practice quite specifically, how we apply these principles in clinical practice. And this was directed toward physical therapists, but we can extrapolate and extend it to healthcare practitioners as well, or consider those principles in light of healthcare practitioners. So one of the statements that they make is, our participants' responses underscore the importance of understanding the frame of mind of another person, or to walk in their shoes in order to do justice to patients' or clients' individually lived experiences. So how can we understand these multiple factors and bear in mind that balance between autonomy and beneficence, as Cohen talked about in the first article? So these three articles are going to give us lots to think about in terms of how do we take these principles and actually apply them in practice, and when do we choose one over another? Individual factors, relational factors, organizational factors, situational factors, societal factors, all influence the decisions that we make as healthcare practitioners. So Sturm recommends that we have ethics training that includes professionalism, professional values, ethical codes, ethical theories, and decision-making frameworks that acknowledge interrelatedness, epistemology, situatedness, self-reflective and communicative techniques, critical thinking, social and societal determinants of health, social responsibility, cultural competence, and self-care techniques. Wow, that's a lot. How do we translate that into what we do in practice or in education? How does someone like me as an educator make sure that we're helping our students communicate ethics and understand ethics and the ethical decision making that we do? So I feel like this is a good place for us to think about our own self-care. How are you going to find support for your own ethical behavior? How will you take care of yourself? Who will be your support network and your support team as you approach ethical issues in practice? I hope that you have a little bit of fun as you explore these topics and as you think about the complexities of carrying out ethical decisions in healthcare practice today.